Hello, everybody. Dr. Madasa Foge here from CarePoint Pharmacy with another episode of Ask Dr. Foge, brought to you by Hill Report. Today, we're going to wrap up our series on diabetes. The last two series, we covered diabetes at length. If you have not seen those videos, please go back and take a look at them. We had covered what diabetes is, the different types of diabetes, type 1 versus type 2. We covered what the complications of diabetes are. We covered how to control diabetes. Specifically, we talked about lifestyle changes with food and exercise. So this was the last two series. The last series today, we're just gonna go into uh, kind of wrap it up together. I'm gonna talk about medications and if you're diabetic already, how to manage diabetes with medication. Um, of course, when we're talking about medication, lifestyle, the things we talked about in the past two series continues. They still continue to be relevant, especially food and exercise. Medications, I know a lot of people don't, nobody loves to take medication. Medication is what I like to call a necessary evil, but it has to be part of the equation. Some people are lucky enough they can control their diabetes with lifestyle changes. Others might not require medications. Now there are multiple type of diabetes medications, and we can't really go into each and every one of them. But the main ones are usually you have a medication called the metformin, an old medication that we've been using for probably a century. Good medication, solid. Sometimes it gets bad rap, but a really good medication that I would take if I was a diabetic. There are insulins. I'm sure you guys have heard of insulins. Have you seen insulins? Um, the more recent ones there's a lot of frenzies going about them are something called the GLP-1 agonists. Those are hormones that we inject weekly. They're not insulin, they're not oral, but they're weekly injections. The semaglutides like Ozempic, Trulicity. Um, I'm not sure if you can say names of medications on social media, but nonetheless, those medications are extremely important, and we need to kind of talk through a little bit about them. Just because you're going to see them a lot. You see them on your, I'm sure, on your favorite TV channels every evening. Uh, if you are, and early on with diabetes, usually your doctor will tell you, hey, make the lifestyle changes, eat better, exercise, kind of go back and listen to those videos, like I said, about what that meant. Now, once you get to, and the next round is where we start medications. Usually, we start everybody with a medication called metformin for diabetes. Metformin start low and usually gradually go up to a high dose of around 2,000 to 2,500. And no, if you incorporate lifestyle changes, you're typically able to maintain control your diabetes just with metformin. Now, you can reverse the diabetes, meaning you can come off of metformin, it's just control diabetes without taking any medication, so long as you maintain the lifestyle changes, meaning eat well, exercise. But many times over the years, your body may require medications like metformin. And metformin, after some time, may not work as well. They may add on few other diabetes medications that come on board, usually two or three oral medication before we go into insulin. Now, insulins are usually reserved for more serious need for control diabetes. In other words, your A1C, which is the average blood sugar over 3 months, is really high, and I've seen as high as 18. And those are where they usually want to go in and give you insulin to make sure that we bring it down, because now we are really in an emergency zone if your sugar is that high. Um, if you are already on insulin, you probably know very well insulin is an extremely dangerous medication where you can get too low very quickly if you don't take good care of yourself, and if you over inject. Sometimes patients will say, I have insulin, and they end up overeating and they try to over inject, or they try to make up for it by taking more insulin, and that's a bad thing. So you usually want to follow what your doctor advises. Here at CarePoint, if you are on insulin, what we do is we put you on a device called Dexcom. Excellent device. It goes on your arm. Some people like to wear them on their buttocks, and what it does is it gives you blood sugar in real time. So you can actually, instead of having to poke yourself every day and check your sugar, you can actually have it on your smartphone. It also has its own device that it comes with. You can actually see your number um, in real time without having to poke yourself. If you're on insulin, a lot of insurances do cover that. They're expensive devices, but they are fully covered. Medi-Cal, Medicare, they usually cover. Um, so if you are on insulin and you're not on one of those, my suggestion is ask your doctor to put you on one of those. If they have a problem, they can call me. I'll be happy to walk them through how to order those and how to make sure that they do the proper paperwork called the prior authorization to ensure that you receive those. That's insulin. Now, with the weekly injection, the the frenzy is now with the weight loss. As you would probably imagine, a lot of our diabetics, type 2 diabetics, tend to be overweight, and these weekly injections are helping with uh, controlling the weight, which indirectly is also controlling the diabetes. They usually work by slowing down your digestion, so you're not eating as much. Because you're not eating as much, your sugar is less, and you're dropping some weight. Now, a lot of celebrities are using it for weight loss, so it's been extremely tough to actually get this medication into the pharmacies and dispense it to our diabetics. So we're doing our best to make sure that we have enough for our patient, established patient. Sometimes it's really hard to bring somebody on from outside and order those for them because it's hard to get them from the suppliers. There are some that are approved for specifically for weight loss. There are some that are used for diabetes, but we use it as a weight loss agent because that's as a side effect of it. Semiglutides are either the Wegovy or Ozempic is what I'm talking about. Those are the main ones that we usually Tirzepatide, Zipbound. Now there are new ones. Those are really good medications that can help you if you need that weight loss and you're diabetic. Now, the sometimes certain patients are required to be on those medications because they have other underlying conditions, like like a previous stroke or heart attack. So the FD or the CDC and the American Diabetes Association, um, they recommend that we put those patients on that class of drugs because we found them to be cardioprotective. In other words, they prevent another attack. Outside of that, those are not the answer to all of the problems. Specifically, especially if you're taking them for weight loss, I highly recommend that you need to start titrating down over time. My suggestion always is the lowest dose and for the shortest amount of time and come off of it. On top of the prescription medication, there's a lot of supplements and vitamins. I usually work really hard to learn the various supplements and vitamins. I am truly committed to reversing diabetes, so I'm always um, trying to learn as much as possible to reverse diabetes without having to take medication. And I know supplements are part of it. So this is kind of what I do. It's kind of my own little functional medicine when you come to CarePoint. What we do is we'll definitely include the medication that you need as a prescription. We'll also talk about the various supplements you need and that are good, overall good for you, not just for diabetes, but the overall well-being. We're talking about vitamins. We're talking about some really good high-end supplement that we carry here at CarePoint. So come by, check us out. The If you get your health report, you'll see our information inside. If you mention the health report, you definitely have 15% off of all your over-the-counter supplements and vitamins. That's something I've told all of my staff. So if you bring it in, it's great. All you have to do is come in and tell us, hey, I saw this on Health Report, and you'll get your vitamin supplement discount, and you'll get the full consult from me. And good luck and good work.